this video we will talk about treat a muscle tear. Tearing muscles. There are three types of muscles in the human body: smooth muscles, which are involuntary muscles found in the wall of internal organs in the body, such as stomach, bladder, etc., and cardiac muscles, which are the involuntary muscles that make up the heart, and the third type, which will be the topic of this article, is the skeletal muscle, which is the voluntary muscles responsible for the movement of the body, and the movement of the legs and hands. Skeletal muscle tissue consists of a large number of muscle fibers, which in turn consist of a group of myofibrils, and each muscle fiber consists of two types of protein filaments, actin and myosin. The sliding filament theory, which explains the mechanism of muscle contraction, states that actin filaments slide between the myosin filaments, which leads to a shortening of the length of the muscle fibrils and thus contraction of the muscle, and the movement of the joint attached to it. A muscle tear means partial or complete damage to the muscle fibers, or to the tendon that connects it to the bones as a result of being subjected to pressure that exceeds its endurance, as happens when you suddenly lift heavy objects. A torn muscle may result in damage to some small blood vessels, causing bleeding, bruising, and pain due to irritation of the nerve endings in the area of the rupture. The chance of muscle tearing increases in athletes who practice contact sports such as boxing, football, hockey, or the types of sports that require frequent repetition of some movements, which leads to tearing of the forearm and hand muscles such as rowing, tennis, and golf. It can also occur in people who practice occupations that require heavy lifting. Symptoms of muscle tearing. The symptoms of a muscle tear vary according to the degree of the tear, and the symptoms need several weeks to disappear in the case of mild and moderate injuries, but in the case of acute injuries, the symptoms may take months to disappear, and the symptoms of a muscle tear include the following: sudden pain at the site of the injury, muscle swelling and cramping, bruising and discoloration in the affected area, limited ability to move a muscle, hardening and soreness at the site of the injury, a gap in the muscle, power-find GenoTrain knee support brace, pain relieving and stabilizing targeted support for affected and arthritic knees. The symptoms that require calling the doctor are: hear a popping sound when the injury occurs, muscle weakness and difficulty moving compared to the other side of the body, severe pain and swelling at the site of the injury, severe back pain that prevents the victim from performing normal activities, or moderate back pain that worsens after several days. Back pain does not improve within 2 weeks of receiving treatment. Back pain associated with any of the following symptoms: feeling of numbness in the groin or rectum, pain and burning when urinating, fever and chills, difficulty controlling urination or bowel movements, numbness or tingling in the leg, severe pain that does not enable the victim to walk for more than several steps. Severe pain prevents the victim from sleeping. Diagnosing a muscle tear. To diagnose a muscle tear, the doctor may resort to the following: clinical examination, X-ray examination, computerized tomography (CT) scan, magnetic resonance imaging. Treating a torn muscle. It takes a lot of time and patience. Where the treatment begins immediately after exposure to the injury and continues until the muscle regains its strength again, and the methods of treatment include the following: providing assistance to a muscle-torn patient immediately after injury using the Price principle. In order to obtain the best treatment results, the Price principle is an assembly of the first letters of a word: protection, rest, ice, compression, elevation. This principle is intended to follow the steps of first aid that must be included. Protection. That is, protecting the injured muscle from complications that increase the severity of the injury. Comforts. That is, avoiding any physical activity that may cause pain and delay healing. The snow. Use an ice pack to relieve pain and prevent infections, and the affected blood vessels close, where it is advised to put ice packs on the site of injury for 20 minutes every hour, with a towel or other barrier between the body and the snow. Compression. An elastic compression garment without tightening the area of pain in order to reduce swelling. Elevation. Elevating the affected part to reduce fluid buildup and thus reduce swelling. Putting hot compresses a day or two after the injury, that is, after the swelling subsides, which helps to relax the muscle, while putting hot compresses before the swelling subsides, the pain and swelling increases, and hot compresses directly on the skin should be avoided. Take anti-inflammatory drugs and painkillers such as Peverine and Advil to reduce pain and enable mobility. After the acute pain and swelling has subsided, work begins to rehabilitate the injured part, as healthcare providers perform physical therapy for the injured muscle and instruct the injured to do a set of exercises depending on the location of the injury and the extent of the resulting damage. This is to prevent muscle stiffness, and to improve range of motion and flexibility. The ultimate goal of rehabilitation is to enable the victim to easily return to daily activities, and to return to exercise if the patient so desires. The period of rehabilitation depends on the severity of the injury, and the individual's response to treatment. Some injuries may take 8 to 12 months before a full recovery. Physical therapy may include the use of ultrasound waves or massage the affected muscle. A doctor may resort to surgery to repair damaged muscles and ligaments, depending on the patient's expectations for post-recovery. Prevention of muscle tears. Muscle tears can be prevented by following the tips below. Stopping exercise or training when feeling pain or fatigue, and muscles are not strained. Eat healthy foods that contain all nutrients to maintain the strength of the body's muscles. Choose appropriate personal protective equipment when playing games and sports. Maintaining a healthy weight, because extra weight puts extra pressure on the body. Take necessary measures to prevent tripping on things, by keeping the corridors and stairs free of clutter, and avoiding slips during the winter. Jogging on flat surfaces only. Wear appropriate shoes, and replace them as soon as they are damaged. Do stretching exercises on a daily basis. Ensure physical fitness before starting to play sports. Not neglecting to warm up sufficiently before participating in training or exercising. Bending the knees when lifting heavy loads, and avoiding bending the back. Avoid twisting movements. Stop smoking, to improve blood flow to muscles. Try any of these recipes and share your experience with us. If you like video, give it like and share with your friends. For more tips and tricks, subscribe the channel.